The final section here is on the policy impact. And I think we start with there's government policy. Okay? This is true around the world. There is monetary policy, which has to do with interest rates and money supply. And then there's fiscal policy, tax and spend. Now, when we look at this, there's policy output, these things done by agencies in pursuance of decisions or statements. And then there's outcome, there's results. The consequences for society, intended or unintended, that stem from deliberate action or inaction. Okay? And that's the impact. That's of the outputs and the outcomes. The things that they're doing plus the results of what they're doing is our policy impact. It's a global phenomenon, different countries, different culture. It's not just financial, but it's social issues at the same time. We're only going to look at a couple of these so that you have some sense of what they are and the key ones. The first is monetary policy. This is done by the central banks. Almost every country has a central bank. Some are independent of the government and others are dependent. In the United States, the Federal Reserve Bank is independent of the government itself. Congress oversees the Federal Reserve System and its entities that relate to it. So they're governed by a board of governors, different reserve banks, and supervised by the board of governors. Then there's the Federal Open Market Committee. This is probably the most important part of the Fed. What is their focus? The Federal Reserve has a dual mandate: price stability and maximum employment. So they're balancing that. Price stability means that the economy is not experiencing high inflation or deflation. Experience over time has shown that the economy performs well when inflation is low and expected to be remain low and predictable. And maximize employment. So it's this balance. Now, we have been, prior to the COVID, we have been in that maximum employment zone. We've had minimal inflation, so the Fed has achieved what it's won. Now, that has changed with what has happened with COVID-19 and the employment situation that we talked about. The Fed has a couple of policy tools. One is that it runs an open market ops, which essentially is just buying and selling treasury bonds. And this is the major form of monetary policy, is buying and or selling government securities. There's the discount window, and they lend to member banks. And what they're trying to do is target through this the Fed funds rate, which banks pay between each other. They can also change the required reserve ratio, how much banks need to keep aside. And these things here affect short-term rates. Long-term rates are set by the market. Now, what we've seen is over the past, this goes back to 94, we've seen inflation, the highest it's been at 275. The target is 2%, has been. Okay? And during expansion, we've seen it close to about 165. Now, what's happened is we've moved into this. The core inflation is down. Now, that doesn't mean everything is down. That just means this basket of goods is. So food prices are up where other things are down. Travel, clothing. Okay? So this is, they're trying to create these jobs and keep stability with low inflation. But they're going to try to let it run up a little bit. So it's way down here, and they were hitting the target just here a year or two ago. But this is a puzzle they're trying to figure out. They hold a lot of assets. Okay? And when you see that, there's $7.363 trillion. If we go back here, that is just about $4 trillion at the beginning of the pandemic. And what we've seen is the Federal Reserve has been buying securities to keep liquidity in the market, keep interest rates low. But what drives that overall? Yes, the Fed's actions can, but it's supply and demand, what we talked about at the beginning. The more money is in demand, the higher the rate. The lower the demand, the lower the price. They also look at the risk and return profile. The longer you lend money, the higher the rate. The shorter the term, the lower the rate. The greater the credit risk, the higher the rate. The better the credit, the lower the rate. So this is a supply and demand fixed by the term, tenor, as we might say, and the credit of who you're lending to. U.S. government securities have no principal risk because the government can always print more money. They do have inflation risk, so that's an important thing to keep in mind. This is the current interest rate environment. This is the 10-year note. This is a Treasury obligation, and today it's at 0.941, just under 1%. So somebody, an investor, is willing to buy a 10-year U.S. Treasury note for 0.941. Look at how small the return is as you work your way down. For a month, it's 0.09. 5-year, 0.377. 0.658. 1.678. Why this is important is because interest rates are low. It provides opportunity for companies to borrow, with the goal being if they borrow, they invest in their business, and that creates jobs. But it's incredibly low because inflation is intended to be low, slow growth, and the abundance of money. What are the actions that the Fed has taken during this time? They've lowered the Fed funds target rate. They've guided. They said that we're going to continue to have low rates for the foreseeable future. They're trying to provide liquidity. They've already put in $3.5 trillion to keep liquidity, keep things moving. They're lending to securities dealers, low rates to 24 what we call primary dealers. These are the dealers that create the market for Treasury debt. They're lending and doing low rates. They're backstopping money market mutual funds. They are in the repo market, repurchase agreement. We'll talk about that for those of you that don't know. Over $1 trillion overnight. Direct lending to banks at the Fed window. They're setting up a swap line. You don't need to know what that is, at least if you know. If you don't, regulation easing. But this doesn't help with solvency. It simply keeps the markets liquid. And by doing this, keeping the interest rates low, what you have is a lot of people who invest in fixed income securities aren't making enough to cover inflation. So that's what's one of the biggest reasons of what's driving the equity markets is interest rates are so low that people are willing to take risk to get some return to try to beat inflation at least. The other thing they've done, these things have never been done before. One, direct lending to major corporate employers by buying bonds. Direct lending to states and municipalities. Buying bonds secured by auto loans and credit cards. So the Fed has done an awful lot to prevent this situation with COVID from getting significantly worse from economic perspective. Next thing is tax policy. That's the monetary policy. The Fed does that. So you can see the things they do there. We have tax policy. Taxes really have two aspects. One, generate revenue for governments to pay for expenses. Second, more importantly, is to encourage certain behaviors. And these behaviors can be incentive spending by consumers or companies. The intent is to use taxes to cause inaction. Okay, so that's the tax policy. And we've seen tax reform. We've seen in the current $900 billion relief plan some very specific tax policy changes. We won't get into them here, but they're trying to incent behavior. Then there's what the government spends, okay? And if we look here, the deficit, this is the actual, and as it's getting, the deficit is increasing significantly and will for the next few years, somewhat based on the 2017 Tax Act that reduced revenue coming in. And if you have less revenue coming in and you haven't cut your spending, you have a bigger deficit. What has Congress done from a spending point of view, a fiscal point of view? They have prepared a number of bills, the big one being the Coronavirus Aid, Relief, and Economic Security at $2 trillion. And there's pending right now a $900 billion plan to provide relief. But as you know, or at least as of this the time of this recording, the president has said he wants $2,000 per person as opposed to $600. So we'll see where that comes out here in the next few days. So there's something planned. It's a very unusual situation with that because the Secretary of Treasury agreed with Congress. Congress approved it, and they thought it was a slam dunk, and then the president came back and said it's a terrible deal. So we'll see what happens. And when you go back to what we were talking about previously, the lower income individuals adversely impacted, and they're the ones that need the help. Okay, they have to make a decision between food, rent, medicine. So we'll wait and see what happens there. When we look at how this $2 trillion breaks down, the biggest one, individuals, $560 billion. Big corporations, $500 billion. Small business, $377. State and local governments, $340. Public health, $153, and education, about $4 billion. So as you can tell, individuals got the lion's share of the $2 trillion, and then the big corporations, of course, got almost an equal share. That is disproportionate. Small business, which employs the most people in America, got that. So that's that. So that's the policy. We're only going to take a look at the healthcare policy, which is currently the Affordable Care Act. And when the Affordable Care Act was passed, it moved to a more prevention and lower cost-based model instead of an emergency response. Lower cost, better outcomes. A hospital has to treat you irrespective of your ability to pay. So the way the Affordable Care Act was structured is that you could get more preventive care and not wait till it's too late to get into, and if it's too late, then you get into the hospital and you have more complications, and that becomes more costly. The other thing it did is it standardized coverage definitions, including mental health and chemical dependency. Prior to the Affordable Care Act, there was no standard definition. You really had no clue what your policy was covering or what it wouldn't, which left a lot up to healthcare companies. With the Affordable Care Act, they standardized that you have to define certain things. You can do add-ons and other things, but there's a standard definition if I'm comparing policies. From your benefit, adult children covered to 26. If the Affordable Care Act is struck down by the Supreme Court and it is pending in front of the court, you have a problem because you won't be covered under your parents' policy anymore. So you're going to have to figure out, how am I going to get health care? You can't be denied coverage because of pre-existing conditions. So when you look at it fundamentally, despite what you think, there's some really major benefits from the Affordable Care Act. You're impacted positively by it. So if it is struck down, start thinking about how you're going to obtain health insurance and if you can even afford it. 10% of the population uninsured. It's more today. 30 million people have no health insurance. So they don't have any health insurance. Whenever it gets, they have a small problem, they don't go to the doctor. If they have diabetes, they may not be taking their insulin, heart medicine. And that becomes very, very sad, but it also costs the taxpayer money and hospitals money. Because when they go to the emergency room, they tend to be sicker and they have to be treated, irrespective of their ability to pay. When we look at this, 46% of Americans are covered by employer group plans. Medicare, which is for seniors, is 18%. Medicaid, provided by the states, is 16%. Obamacare is about 7.2%. And then the uninsured is still about 8.4%. So you probably got 60 million people that could be negatively affected by that in the healthcare space. What's interesting here is that the U.S. spends $10,348 per person average, compared to Switzerland, Germany, Netherlands, Austria. Actually, we spend more money than anybody else, almost double in many cases relative to the average. So then you might say, wait a minute, with that, we should have the best health care. Well, when you look at outcomes and risk factors, let's take a look at a couple of them. Life expectancy at birth. U.S., 78.8, 81.2. Not working there. Infant mortality. These are the number of deaths per 1,000 live births. 6.1. That's significantly more than the rest of developed worlds. Look at the percent of population 65 or with 2 or more chronic conditions. 68. Okay, we look at Sweden, Switzerland, UK. These are big differences. Obesity, we're the biggest. Percent of population are daily smokers. Hey, we're actually pretty low in that. Percentage of population age 65 plus, 14. These countries tend to be a little older, but they're healthier. So we're spending more and we're getting less outcomes and risk. What's the difference? All of these companies have single payer insurance. We don't. When you look at, this is another scary one, the prevalence of opiate use. We're almost 6% of the American population uses opiates. Okay, and then you work your way down to the others, it's not there. We have a lot of other policy, and they involve energy and environment and energy, healthcare, transportation, worker safety, consumer production and finance, agriculture, and immigration. And there's a number of these that the current administration is trying to implement. And whether they're good or bad, a lot of them, they're in regulatory. Okay. Environmental being a big piece of that. Safety. And these things are very important. But at this point, with some of those things, you don't have to worry about the environment anymore. Who needs safe drinking water anyways, So that's sort of other policy. But there's long-term impact of these. Okay. It's not a short-term thing. Putting it together, wow. I don't know. It's unknown. There's so many different variables that go into the future as we move into 21, and a lot of risks which we can manage. But have hope. There's opportunity. And I think you look at this, it'll pass. Can we have a growth mindset? What can we do to benefit ourselves? How do these things impact you personally? Good question. Jobs. Predict jobs that will be in demand over the next 10 to 20 years when you will be working. So you can focus on your skills development so that you can have a job. Ability to support oneself and family. Oh, by the way, not a low-wage one here, but a high-wage one. Ability to support yourself and your family. Quality of life. What do you want to do? Do you want to travel? What do you want? Ability to create wealth, planning for your future. So these are important things that impact you as an individual right now, December 9th, 2020 and January 2021. How does it relate to the courses we're doing? Firms operate within this environment. The issues discussed impact the strategy the firm takes and their ability to achieve their goals. That helps us interpret financial data. They make capital decisions. That includes human capital planning and actions, recruiting, training, retention, compensation, performance management, and plan for production, including people. So this is there's a lot here, but as we move forward to look at the firm from a finance or organizational perspective, the firms operate in these environments that are impacted by these trends today and in the future. So if we want to be able to understand the future and where it is going, we need to understand the environment and some of these mega trends. So if you have any questions, please let me know.